4-year-old Alexandra Ajoy and her mother jetted back into the country Saturday afternoon. Excited friends and relatives were waiting to greet her when her mother wheeled her out of the airport arrival lounge. Alexandra had been away from the country for medical treatment for more than 9 months. Although still masked to protect her delicate skin and lungs from infection, she could afford to joke about her condition. At a tender age, Alexandra has gone through a lot. She's been battling leukemia or cancer of the blood for almost 2 years. Much of it spent in India, where after several rounds of chemotherapy, she underwent a successful bone marrow transplant.
Very difficult thing because the baby really suffers, the baby is really sick, and really they tell you from the beginning that the treatment itself can cause death.
Although Alexandra is still a pale shadow of her former self, the family is upbeat that she's on her way to recovery. A successful bone marrow transplant can increase the likelihood of a cure or at least prolong the period of disease-free survival for many leukemia patients. Despite turning to India's affordable hospitals, Alexandra's family had to raise about 6 million shillings for the treatment that saved her life. This cost means treatment is out of reach for many patients, but Alexis, as she is fondly referred to, was lucky to get assistance from well-wishers, the Kenya Cancer Foundation and the African Cancer Foundation, among others. Having come this far, her family is upbeat she will be testimony to how manageable cancer can be if funds are set aside to assist those who need the treatment. While the government puts the number of new cases of cancer reported every year at 30,000, other sources say the figure could be as high as 80,000. There is no doubt, however, that this group of diseases is now a major healthcare concern. These commonly include cancers of the breast, cervix, throat, and prostate. About 27,000 of these patients are taken to care at the Kenyatta National Hospital. The few that can afford it or have good enough insurance seek treatment with private healthcare. Stories like Alexandra's show what miracle can be achieved with the right use of modern medicine. Mwendo Kiogora, KTN, Saturday Night.